All right, so hello and welcome to our Stop TB Canada National Call. For those of you who are new to the network, the purpose of these calls is to bring together all those working on TB in Canada for an informal discussion to share information and coordinate our efforts. So before I begin, my name is Lee Racey and I'm the Policy and Advocacy Officer at Results Canada, leading our tuberculosis work, and I'm also a member of the Stop TB Canada Secretariat. I'd like to start by paying respect to the Algonquin people, who are the traditional guardians of the land where the Office of Results Canada is located in Ottawa, and we acknowledge that their long-standing relationship with this territory remains unceded. The Algonquin peoples have long lived on this land since time immemorial, and we are grateful to have the opportunity to be present in this territory today. These calls are intended to be an informal discussion among peers. So to kickstart, it'd be great to know who we have on the call today. So feel free to introduce yourselves in the chat. Just going to share my screen. All right. So in terms of the agenda for today, we'll start off with a brief report back from the Stop TB Canada Secretariat on our recent progress. Then we'll have two guest presentations on research and development and TB diagnostics from TB Alliance and FIND. That will hopefully help stimulate an open discussion among participants on the importance of this work. And this open discussion will also be an opportunity for you to share any of your recent or current projects within this space. So starting with a brief report back from the Secretariat on our recent work since our last national call. We've been super busy continuing to build the network and engage with the broader community of TB advocates. So I'll start by highlighting a couple of our key projects and priorities of the last couple months. One of our main priorities of the network has been assessing the impact of COVID-19 on TB programs in Canada through a survey initiative, publishing the report on these findings, and holding a launch event to share these findings along with the necessary calls to action to getting back on track to ending TB in Canada. And I'll be sharing a link in the chat where you can access both the published report as well as recordings from our launch event, where many of the leading voices in TB in the Canadian context commented on the importance of this initiative and their thoughts on what's needed moving forward. And the findings of this initiative are devastating, but maybe not surprising given the impact that COVID-19 has had on health systems globally. So respondents of the survey reported diagnostic delays and individuals presenting with more advanced disease, large-scale diversions of TB staff to COVID-19 work, significant disruptions to active case finding, contact tracing, and LTBI management, and declines in quality of TB care during the COVID-19 pandemic. So all of these findings really suggest alarming setbacks for efforts to end TB in Canada. And now that the report has been published, we'll be using these findings for our advocacy, starting with political outreach. So we're currently reaching out to MPs across the country that we've identified as being in regions with higher burden of TB, whether in nearby Indigenous communities or newcomer populations. So we'll be having these meetings with MPs to introduce the network, educate them about TB, and discuss what's needed to scale up efforts to end TB amidst COVID-19. And these types of meetings are the perfect opportunity to bring in the knowledgeable and diverse voices that comprise our network. So if you're interested in taking part in any of the parliamentary advocacy, such as these MP meetings or other meetings with decision makers, make sure that you're part of our directory. So I'll be sure to add that to the chat as well in just a moment. There we go. And this brings me to my next update. So I'd like to share that the network has just opened up for applications to join our steering committee, and we would encourage you all to apply if you're interested. Just for a bit of context, the steering committee was developed last year to help guide the strategic development of the network by providing perspective, guidance, and advice to Stop TB Canada's operations. So if you're interested in learning more or applying to be part of the steering committee, I'll pop the form in the chat. And if you can fill that out by December 15th and share with others in your network who you think would be a good fit and value add to the network, that would be great. So I'll just share that link in the chat as well now. All right. And lastly, I'd like to just provide a quick update on another initiative that we're prioritizing, which is building a community for those affected by TB in Canada. So far, we have a Facebook page created and a flyer that's being shared at TB clinics in an effort to grow the group and provide a safe space for those living with TB, TB survivors, their friends and families to connect and share resources and provide support to one another. And I just wanted to update that we've just hired an intern, Nwang, to help drive this initiative forward. So we're really happy to have her join the team and looking forward to seeing what comes of this project. So that covers our recent work from Stop TB Canada, and I would now like to pass it over to Adam Graham, an active member of our steering committee, to introduce today's topic and our guest speakers. So over to you, Adam.
Thanks, Lee. Hi, everyone. My name's Adam, and I work with Plan International Canada, which is a member of the Stop TB Canada network. My work intersects quite a lot with financing from the Global Fund, mostly in West Africa and East Africa, as well as financing from TB Reach from Wave 7. So Plan International Canada is a member of the Stop TB Canada network. So as Lee was saying, each national call with this group would be focusing on a specific topic. Today's topic looks specifically at TB research, development, and diagnostics. I thought it's worth mentioning just to kind of keep in mind that these discussions are aligned with the strategy to end TB as an epidemic. And so linked with these discussions are the important pillars related to strengthening patient care and prevention, including early diagnosis and management of comorbidities, really demanding bold policies and resources from politicians and other decision makers. We're entering a resource mobilization period for some funders in the TB space. And so now is a time to kind of really push our policymakers and politicians to make those decisions to fund the strategy, as well as meaningful engagement with TB survivors and civil society. And of course, this is the focus of today's topic, intensified research and innovation, including discovery, uptake of new tools, interventions and strategies, and a greater effort on research to drive implementation and to really and truly impact the end of TB as an epidemic. So our second speaker of the day will be Dr. Makashni Kohli, who's a scientific officer at FIND. It's the Global Alliance for Diagnostics, which seeks to ensure equitable access to reliable diagnosis around the world. Organizationally, FIND works to connect countries and communities, funders, decision makers, healthcare providers, and developers to spur diagnostic innovation and make testing an integral part of sustainable and resilient health systems. Our first speaker on the agenda is Anna Marie Harkins, who is the Director of External Affairs at TB Alliance, which is a not-for-profit organization dedicated to the discovery, development, and delivery of better, faster acting and affordable tuberculosis drugs that are available to those who need them. The TB Alliance is a product development partnership, which is uniquely positioned to leverage its global network of public and private partners to most efficiently advance TB drug treatment. So without further delay, over to you, Anna Maria, and we look forward to your discussion.
Thanks very much. Can everyone hear me okay?
Yes,
perfectly, yeah.
Great, thank you. It's wonderful to be here with you all this morning, and thank you for inviting me to speak on this topic. And you've done a great job of really just sort of introducing TB Alliance. And I will say that my focus and my role at TB Alliance is indeed around resource mobilization and advocacy for research and development. And like many other PDPs, including FIND, we have been working for almost 2 decades using this product development partnership model, which has really been transformative in terms of being able to develop new health technologies for so-called diseases of poverty. So I'll just focus my remarks today, again, on resource mobilization, but maybe just also saying a few words about how research and development really enriches the entire value chain, especially for the clinicians on this call today. I think you really want to understand how these kinds of investments reach the patient. So I'll just start out by saying just a few words about the TB pandemic, and it's not anything that nobody on this call doesn't know, but prior to COVID-19, TB was the deadliest infectious disease, and it created 10 million cases of TB a year and 1.5 million deaths in 2020. In addition to that, drug-resistant TB is on the rise, and it's really a major contributor to antimicrobial resistance more broadly. And I think now also, as it relates to COVID, we know from the most recent WHO report, but also other modeling, that the situation with TB detection and treatment has been made significantly worse, and we've really been experiencing major setbacks. But let me just step back and try to say something positive for this group of people, because in the midst of all of this, there have been some really important advances in TB research and development, and I'll just highlight a couple that I know best about from TB Alliance. One is the development of child-appropriate therapies for drug-sensitive, in other words, for first-line treatment, in a landscape that really previously had no child-friendly formulations and proper doses for children. We had people splitting pills, crushing pills, trying to mix them up with things, which really resulted in not great outcomes and suboptimal treatment. But what we've seen now with fixed dose combinations of a dispersible tablet dosed for children is more than 1 million treatment courses of these therapies have been ordered, and that represents about 75% of the pediatric TB population. And secondly, we've made some real transformative progress in treating the worst forms of TB, extremely drug-resistant TB, with a 3-drug 6-month regimen called BPAL, and it's bedaquiline, protomanid, and linezolid, and that regimen was approved by the FDA in 2019 and by the European Medicines Agency the following year. And we're now doing the hard work of product introduction and rollout. This drug regimen has a proven cure rate of 90% of those with drug-resistant XDR TB. And again, it's in 6 months. Protomanid, as part of this regimen, is available in more than 170 countries around the world. Transitioning just to research and development for TB funding, it's, prior to the advent of nonprofits like TB Alliance, FIND, but also IAVI and TBVI, we really saw decades of neglect in the R&D space. There's really no commercial market, and there's not really strong enough incentives for the pharmaceutical industry alone to develop these new tools. The space really relies on funding from governments, including Canada, but also philanthropic organizations and academic institutions. You all might recall in 2019, there was a UN high-level meeting on TB where member states from around the world committed to invest in what was needed to close really the demonstrated funding gap to meet TB R&D investments, but very little has changed over the years. And I'll just round up the TB R&D funding by really saying that the COVID-19 pandemic taught us a lot, right? And one of the things it's clearly illustrated is what true political and financial commitment to a health crisis looks like and what is possible. The miraculous speed at which life-saving tools were developed to respond to COVID-19, it really confirms that the main barrier to responding to pandemic threats is not the scientific challenges, but the willingness to invest the resources that such a crisis deserves. And I think we really need to take a good look at our commitments to NTB and I think come to the realization that we have to really step up in a much more aggressive way. And I'll just finish these remarks by just talking a little bit about research and development and how it helps in terms of health system strengthening and, developing robust tools through research in TB. It helps in numerous ways, but I'll just mention two of them. One is really improved patient outcomes. Higher treatment success rates reduce transmission and relapse rates, and thereby reduces the burden on health systems. And the second thing is really improving the ability to treat more cases. And that is by reducing the time, the cost, and the human resources. It really enables health systems to treat a larger proportion of cases, right? The reduced cost of treatment enables all of your health budgets to go further. Shortened therapy reduces the burden on care providers and hospitals. And simplified therapies reduce the need for highly specialized care and care providers. So again, thank you very much for inviting me to this. I'm happy to answer questions. But again, I always make a clarion call that we really need to exponentially increase investments in R&D for long-standing global health challenges such as TB, and I hope everyone on this call can get behind that. Thanks very much.
Thanks so much. Thanks so much for that. I think I'm particularly struck just before we move to the next speaker on the discussion related to kind of the looking at the past history of decades of neglect, sort of moving into this space where we see massive investments put into a global pandemic like COVID-19, and maybe just some questions that will help our fundraising efforts. We're entering, for example, a period of replenishment for the Global Fund to fight TB, HIV, and malaria, and maybe some of the questions that we need to bring to our politicians looking at specifically issues around equity and empathy to really kind of make those investment decisions, given that the commercial market space is not available for TB in the same way. And the extent to which we would really look at those financing decisions as investments in sort of an equitable approach to global health delivery, I think can really inform some of those discussions. So with that, I am going to now hand it over to our second speaker of the day, which is Dr. Makashmi Kohli, Scientific Officer at FIND. Makashmi, over to you.
Great. Thank you, Adam. Hello, everyone. It is so good to be here. A couple of names that I see on the screen, I work with them, and it's so good to be here. Thank you so much for inviting me. I do have a short presentation and just to talk through a couple of these points. I'm gonna just try and share my screen. Can somebody give me a signal if you can see my screen?
Yes,
Yes, we
100%.
can. Thanks.
Perfect. Hello everyone again. My name is Nikashmi. I was having a hard time trying to figure out how to name my presentation, but I then thought, okay, let me just put it all there. So I'm going to talk about a couple of things. Just giving a bit of introduction of what FIND is, what do we do, and I think Anna Maria really eloquently put together the problem of TB and what are the pillars that are important, and how we can work together in solving this TB pandemic problem that we have for so many decades now. So I'm just going to go through a couple of these points with you, and feel free to stop me in the middle of the presentation. So just about FIND briefly, that it's a global alliance for diagnostics. It was established in 2003 as a product development and delivery partnership. It is a co-convener of the Access to COVID-19 Tools Accelerator Diagnostic Pillar. And it is a WHO collaborating center and also a member of the SAGE IVD. This picture here basically shows the number of projects that FIND is involved in, and the disease profile of FIND is not just TB but other diseases as well, like malaria, HIV, non-communicable diseases, NTDs, etc. And we do have many clinical trials and access programs in country offices across the globe. This slide basically shows how we kind of uniquely positioned to work with starting from product developers up to the policy makers like WHO, Africa CDC, etc., but also academic partners and civil societies and communities, TB survivors, for example. And also we try and work with the people living in high burden countries, high disease burden countries, and trying to understand how we can strengthen the capacity there, but also strengthen the healthcare systems. So it's sort of like positioning, starting from how to develop and what kind of tests to develop up until are these tests actually good enough to be put into the field, and then once you're there, you have these tools, then how do you increase the uptake of these tools in countries and in places where they actually are needed? So I think everyone on this call knows that diagnostic is one of the important pillars, and we being the global alliance for diagnostics, we definitely try and work together with various partners on not only bringing out the best type diagnostics, accurate diagnostics, but also having them increase uptake in places where it is needed the most. There have been many publications, op-eds that have been written about the importance of diagnostics, but I think very recently, the Lancet Commission on Diagnostics gave a statement which should be an eye-opener to everyone. At least it was for me when we saw that about 47% of the global population has little to no access to diagnostics. And then this was part of some of the work that I did with the commission, was that this graph basically shows the cascade of care for 6 tracer conditions in low and middle income countries, and definitely TB is one of them. And we saw that the gap here for diagnostics was the largest gap in the entire cascade of care. And when we did a bit of modeling, we saying that, okay, let's assume that if we are able to diagnose 90% of the people in the world, what will happen? So if we could diagnose 90% of the people, that means increasing this bar up to 90. For just these 6 tracer conditions, we will be able to save 1.1 million lives globally every year, which I think would be a great impact if we can actually diagnose 90% of the people. And Diving a bit deeper for TB, the story is definitely similar for TB. There have been individual studies, but also systematic reviews which have tried seeing this cascade of care for active TB disease. And we see that diagnostics, this step is definitely the one important step in the cascade of care where people fall out of the cascade majorly. Okay, moving to the diagnostic landscape of TB. We know that TB is a spectrum from infection to active disease. We currently do have tests which are skin tests and EGRAs that look at TB infection, but there's a lot of development that's happening in this field as well. There are newer tests that are coming up that look promising in terms of the accuracy of these tests. And then we have triage and screening tests that we currently rely upon: clinical symptoms, CRP. Chest x-rays have been there for a long time, but recently WHO endorsed a computer-assisted detection for chest x-rays, which is definitely helpful for countries that do not have very trained radiologists to look at these chest x-rays. And then for active TB disease, we have microscopy, culture-based methods, antigen-based tests, and then nucleic acid tests. This is the arsenal of TB diagnostics, how it looks like right now. But then honing in on these diagnostic tests a bit more, we have this basket of tests for microscopy, culture, and phenotypic DST. We know that these are the reference standards that we use currently, especially culture. And then antigen detection, currently we have a layer lamp, which is basically used for people living with HIV, but the accuracy of this test, we all know is suboptimal. So I also want to bring out a bit of a contrast here as to what tests are available and what is coming up. So just to say that the developments are definitely happening in this field of diagnostics for TB as well. So we have a newer assay called the Fuji Lamb, which will undergo policy evaluation in the summer of 2022. But also there are third generation lamb assays that are coming up, and people are trying and working really hard to get these tests to people who really need it, and they have optimal diagnostic accuracy, but also which are point of care tests so that we can close on the gaps and find the missing millions. Then this realm of nucleic acid tests, I think we have lots of new tests that have come up, which have also undergone WHO policy recommendations in the last 2 years. And this is a screenshot of the consolidated guidelines by the WHO and how they were recommended by the WHO based on different principles of these tests, whether they were antigen based or the complexity of the assay or what they are basically detecting. So this is what the recommended basket of nucleic acid tests look like. And I'm not going to go into the details of this, but just saying that we are moving away from the conventional culture-based methods to rapid, accurate tests. And then courtesy of the COVID-19 pandemic, I think a lot has changed in this realm of diagnostics, and specifically molecular diagnostics. People are looking to get diagnosed rapidly, accurately, but also at point of care. And this is how we see that the newer tests our developers are working on. They're trying to make platforms which are more affordable. They're trying to make use of multi-disease platforms, something that requires less maintenance, but also adding in more drugs for testing and not just relying on rifampicin and isoniazid, which are the first line drugs for TB. And then moving away from sputum-based sampling to non-sputum-based sampling, which I think would be a game changer specifically for pediatric TB as well. So these are the two directions we see the innovations moving in, one towards more point of care platforms to closing the gaps, actually reaching people where they seek care. And then also in the direction of high throughput assays and achieving the goal of universal DSP by adding more drugs. And I will not spend more time on this, but just to say that bigger programs such as one by the NIH RADx program for COVID-19 was put in place for COVID-19. But then I think a lot of these developers are working and trying to use those same platforms for TB detection and drug resistance detection as well, which I think is a positive thing to look at, because then you can actually use those platforms for not just TB, but you can also use it for other diseases, try and have cheaper tests. Some of these tests are basically developed for swab-based TB detection and moving away from sputum. And then again, we also have sequencing, that is, we are looking forward to more of these point of care sequencing platforms, which are looking more realistic now. And so this is how I wanted to build up a bit of story. So we have the diagnostic landscape. There are newer tests that are coming up. But we firmly believe that just putting out newer tests or newer diagnostic tools is not going to solve the purpose. We really need to strengthen the healthcare systems as well. So FIND and the Lancet Commission on Diagnostics, they launched this commission report on 6th of October 2021. And this commission basically provided 10 recommendations, which deals with having newer tests, but also strengthening the systems together so that we have more commitment, political commitment, we have proper funding to put all of this together, involvement and inclusion of civil societies, survivors, academics, and all the key stakeholders under one roof so that that problem can be solved. Rather than working in silos, I think it is high time that we start working together. And if not now, then I think the question is when. If we haven't learned from the COVID-19 pandemic, then I think it will all go in vain. But I think we have learned from the pandemic. Lastly, just touching about TB in Canada, and the reason that I also wanted to put this out was there was one when I was doing my postdoc at McGill, there was one lecture which was especially very moving to me. It was given by Nathan Obed, who was the president of the ITK. I think I would definitely say that it came out as something which was very surprising, coming originally from India, and I had very less idea about that. The problem of TB also exists in Canada, and especially among the Indigenous population. And there have been a lot of literature about the incidence rates being very significantly high, and how there is commitment to end TB among the Inuit population by 2030. And this was one of the report which is very convincing and beautifully put together by Stop TB Canada report, and one of my colleagues here, I think she's on the call, Lena, also worked on this. There were very compelling findings from this report, and we all know that COVID-19, how it has impacted the TB programs globally and also definitely in Canada. So just to sum it up all together, we know that these problems are there among the Indigenous population. When I presented some of these diagnostic tools, I focused majorly on point of care testing, we know that one of the issues in the Inuit population is that there is suboptimal access to healthcare settings, suboptimal access to diagnostic tools. So that is why I think it's important to bring those tools where people really need it. For example, portable chest X-rays, non-sputum based sampling, in fact, better transportation materials so that it is easier to diagnose people rather than asking them to come to centralized labs. It's better to get them diagnosed where they are. And I think all these targets that we have in the TB field, it is important that we work together. We definitely need sustained funding for that. We also need that we work together and have data sharing. And definitely political commitment and partnership is important. I think we strongly believe that it is, if we work together and break the silos, we can definitely get everyone who needs to be tested at the right time and accurately. Just a screenshot of the partners and donors that make some of these things possible for us to work at find and deliver quality and appropriate diagnostics to people who really need it. And thank you. Happy to take any questions.
Thanks so much, Dr. Kohli. I really appreciate that presentation, and I'm struck with optimism on kind of the movement toward point of care testing. I know from my limited experience working with some of my colleagues in rural Nigeria that there's just such a massive outlay of human resources, of commodities, to be able to actually bring sputum sample collection directly to the household level. That just really takes a lot of work and a lot of effort. So any move towards sort of more an approach that kind of brings that testing, and certainly we've seen that in the HIV sector, that it really increases access and hopefully equity as well to better TB diagnostics. I'm going to throw the floor open for questions. We've been presented with a lot of really compelling information, looking at both the kind of the diagnostic side, looking at the financing side, seeing some of the kind of similarities between or the potential that we have to kind of increase output in terms of reaching more people with TB diagnostics. And I'm just wondering if there's any comments from the floor from anybody's experience, anybody wanted to share their work just in relation to what was presented today. Feel free to put up your hand, the digital hand. If you want to turn your camera and put up your actual hand, you're more than welcome to do that too. Maybe while people are kind of getting their questions together, one of the reflections that I was having in listening to both of our guest speakers today was on kind of on the sort of the barriers around kind of moving forward with sort of looking at the geographical barriers, the economic barriers, the sort of social barriers around stigma and misconception around TB. We talked a bit about regimen complexity, so that is sort of already included in the picture, but I'm just wondering, maybe from the speakers, do you have any thoughts on sort of how we overcome, while sort of working to better diagnostics, kind of what do we need to do to really kind of work on some of the more kind of social aspects of this? And so looking at things like, for example, perhaps gender equality as part of the equation in care-seeking behavior, for example, for men, or access to better diagnostics for women. How do we sort of at the same time really look at increasing diagnostics and increasing the kind of technology and availability, while at the same time, doing that essential work on the more social end of things. Curious if anybody has any thoughts on that.
I can try. Okay, I can try. So I think that's a great question, Adam. For me, and this is what we are trying to put this all together, is that unless we really involve and engage people who have gone through this, we are never going to understand the problem. So I mean, we try doing advocacy, we try incorporating people who the academic minds, definitely we need them, but then also trying to talk to people. Sometimes it's really hard trying to convey our message as an academic to the patients or even the healthcare providers. So I think it is important to engage the civil societies, the TB survivors in our research projects, also other projects that we try doing into as implementation science or operational aspects, and then trying to bring that into perspective of sort of destigmatizing this issue. I think, again, I'm going to go back to COVID, is saying that just wearing masks, it was as simple, and we kept saying this to we tried explaining this to people, but then there was a lot of stigma around wearing masks in countries like India, for example. It was really hard when I was doing my PhD in India. It was the most hardest thing to explain it to people that you really need to wear masks. But it came around with a lot of hesitation, understandably. People were outcast from the communities. But I think engaging and talking and educating is important around stigma. That's one thing. And then also about access. So this is one of the things that we are trying to do in one of the Unitaid grants that we have, is adding a gender lens to the research projects, where starting at the product development, when we start making diagnostic products, for example, a urine lamp test, we don't even think how it's going to impact. Is it going to be different for men versus women? If you're creating a point of care test and you're saying that you have to, it's a urine test, we don't even think, is there going to be a washroom at a primary healthcare level for a woman to actually go and use this test? Is it feasible? So these are the kind of questions that we have now started adding into our research, starting from the product development, but also trying to push our partners to ask these questions at the sites when they're doing these kind of projects, where they're doing these kind of projects. So it's about work, again, it's about working together, thinking through, and being more receptive to these questions. It's probably going to help us solve this problem, but yeah, I'm going to shut up now.
No, I think those are great. Thanks, Dr. Khalid. Those are really excellent examples. And yeah, I mean, it's absolutely on the questions of gender equality. You know, there needs to be acceptability and dialogue from the very beginning to make this work. Any questions from the audience? I know, I mean, like, I have a giant basket full of questions that I could just dip into, but I don't, I definitely don't want to dominate the discussions. Anybody else that has sort of anything that they want to talk to, just in relation to maybe even the financing end of things? Yeah, Petra, come on in.
Hi, thank you both, Anna Maria and Vikashmi, for great presentations. That's really good to hear. And I'm still learning very much on the R&D end of the perspective. And I wanted to just reflect from a Stop TB Canada point of view. I wanted to hear from you both, like, obviously there is a major market here in Canada in terms of smart researchers in this whole field of drugs development and then diagnostics and then all of it and vaccines. And I wanted to hear both of your perspectives to how far Canada is currently involved or could be more involved in the TB market and what you see as opportunities, and maybe tie to that for the Stop TB Canada network a question from what type of messages would you like us to pick up from an advocacy point of view, whether it is related to funding or actively getting more engaged into the development market. So wanted to hear both of your perspectives in that regard.
Thanks very much, Anna Maria Harkins from TB Alliance here. I agree. I think that there is a wealth of knowledge and resources that Canada has to offer, but I also feel that it's not being tapped into, actually. So, you know, TB Alliance has been looking for ways to sort of make the case for research and development, including in coordinating with Canadian academic institutions, educational institutions, and research facilities. So, you know, that's sort of on us to continue to find the right partnerships. But certainly, I think that's what I would say is a not fully tapped reservoir of knowledge and resources.
Yep, Dr. NUCLEIC coming in.
Okay, yeah, thanks Petra for that great question. I think for me, what really matters is, as I said, that it is important to work together. There is wealth of knowledge in Canada. We have great researchers. Some of them we have worked with. But just to say that some of these points, it would be good to collaborate the efforts. For example, one aspect around data sharing, and I know that some of the academic institutes in Canada, they are doing this with the WHO, but it would be more, it would be good to have a transparent database, or just being transparent about the kind of research projects that are happening and the kind of research projects that we're trying to build on into. One of the projects I think FIND is working with on Canada is the Diagnostic pillar, and I think about just in terms of advocacy also, it would be good to engage more with partners and donors, and thinking what kind of messages need to be put out there in terms of advocacy. Definitely, I know that there are TB survivors who are there, who are part of this community, but also sinking in the messages from all these partners, donors, product developers. I think they all have a voice and they all have opinions, but putting it out there together in terms of advocacy would be great. And just lastly, before I give it to Michael here, is I think TB research in itself is a bit underfunded. We know that for sure. It would be good to have that commitment to increase funding for TB, whether it's newer drug development or newer diagnostic being developed, and then at the end of it, you put the new drugs out there, you put the new diagnostics out there, but it all has to come together. So maybe integrating the systems together using digitalization, having more of computer-assisted data management, and an end-to-end solution from when the patient really goes up until when the patient receives the diagnostic results, and then is really put on treatment. So the whole linkage, the cascade of care is put together, maybe having more commitment towards digitalizing this and putting it all together rather than having it in pieces. Over to you, Michael.
it's a bit distant. Sorry about that. And just to add to what you have said, I want to recommend to Stop TB Canada that they get involved with the Results Canada campaign, which is really looking to support Canada and encourage Canada to put more money into R&D for TB, but also for global health. There are some benchmarks against which Canada can measure its fair share. And it's an ongoing campaign that's going on in a number of countries that I'm sure Leah will be able to explain. The other point is that we're, as Canada, a bit confused. You know, we spend a lot of our resources for CIHR, Canadian Institutes for Health Research, IDRC, and those sorts of Canadian-centric entities. And other countries are actually quite active in supporting both the domestic and the international. So in the case of TB Alliance and FIND, funding comes from many international organizations to fund the work of product development partnerships. So we have funding from a half a dozen countries that can be pulled together to do some pretty substantial work around moving the needle on better diagnostics. So we're really in an interesting situation because Canada has been very supportive of us for the ACT-A work that we're doing jointly with the Global Fund. Hopefully, we will be able to transition to be seeing Canada become a supporter of the product development partnership model so that you have combined efforts. It's not a lot of money that's needed for R&D, but it does have a very substantial impact. And as we were talking about before, it's not just impact in developing countries. It has, and it will have a really important impact in Canada as well.
Thanks, Michael. Excellent point. I'm actually going to pass it back to Lee because I know that we may be approaching our time for the session. So maybe Lee, back to you.
Thank you. Yeah, I think we are just over time. So thanks so much to Anna Maria and Nakashmi and Adam and others for the discussion. I'm looking forward to bringing what we learned today to our advocacy at Stop TB Canada and hopefully see that result in increased investment for TB R&D and further development to improve diagnostics and care. So I'll just close by saying we will be continuing to hold these national calls every couple months. So feel free to let us know if you have specific topic or content that you'd like to discuss at a future call, or anything else that you'd like to collaborate on. But thanks everyone for making the time to join the call today. And I hope you enjoy the rest of your day and week. Thanks.
Thanks, Lee. Bye.